Hey guys, it's Dave from Dave's Pharmacy. Today we're going to talk about a condition that may affect you, but probably if not you, it does affect a family member or at least a friend. And that is high blood pressure or hypertension. It's a huge issue here in the United States and around the world. And most people don't even know they may have it. Some of the things that you can do as far as pharmaceuticals or medications to take are drugs such as an ACE inhibitor, which is like lisinopril or ramipril or quinapril. Anything ending in pril would be classified as that. They were one of the first choices to go to for blood pressure. They help to lower the blood pressure, but some of the side effects you want to look out for is it can make you dizzy. That generally goes away in about a week, or it can cause a dry cough. Now that dry cough may or may not go away. Don't take anything for it because you're wasting your money. If it goes away, it will do so on its own, but things like Robitussin won't help. If it gets to be a real hassle, let your provider know and they may be able to switch you to something else. Another class is real similar to an ACE inhibitor. It's called an ARB, or an angiotensin receptor blocker. Big word. Those are drugs like losartan or valsartan or olmesartan. Again, they can cause you to be dizzy. And again, that should go away in about a week. Something else that you may be put on is something called a calcium channel blocker. One of the most used ones of that might be amlodipine or even verapamil. You may also see something called nifedipine, which is also more for your heart as well. Those drugs can cause you to be drowsy, cause you to be dizzy. And with certain ones of that class, you want to watch out. You shouldn't take any grapefruit or grapefruit juice with them because it makes the effect stronger. So watch out for that. Another class of drugs that you may see, and a lot of people are on this, maybe for blood pressure, but also if you're having heart issues, and those are called diuretics, or you may have heard them called water pills. You want to make sure you take those in the morning. Because if you take them later in the day, one of the things that is a side effect is you'll be up all night in the bathroom. Because the way they work is to help get rid of extra fluid. And one thing to remember about that is it's good to have a glass of orange juice or maybe a banana a day to help replace some of the potassium and the magnesium that you're losing when you pee it out. As far as other things, there are a few different classes out there like spironolactone, which is potassium-sparing diuretic. And then there are also things like alpha blocker, which is what guys are usually on for prostate problems, but they lower your blood pressure as well. And that would include a drug like Hytrin, which is terazosin, or Flomax, which is a very common drug for men. Remember, with that class of drug, it will cause you to be dizzy. The other thing that is really hard to remember, and a lot of guys aren't told about it, with that class of drug, when you go to stand up or when you go to sit down, make sure you do it slowly because it will make you lightheaded, you'll get dizzy, and you could pass out. So remember that if you're newly put on those medications. The best thing to do, honestly, is not to get to that point. So how do you avoid being put on prescriptions? Well, one of the things that you really need to look at is losing weight and exercise. Both things have been shown to decrease your blood pressure. At least 15 to 20 minutes a day of moderate exercise is good to help lower your blood pressure, to get your heart physically fit, and just to keep you in a better, healthy lifestyle. Something else that you can look at is to decrease your caffeine intake. If you're up past 3 o'clock having caffeine, that's going to keep your blood pressure elevated through the night. It'll also make it more difficult for you to go to sleep. So make sure you cut your caffeine intake. That will help decrease your blood pressure as well. Why some of these things are important is you don't think, well, I'm young. My blood pressure will get better as I get older because I'll have less stress. Or maybe I've got kids now. As the kids get older, it's going to be less stressful and my blood pressure will go down. it's very important you get your blood pressure lowered now, because what happens is your blood vessels will weaken over time when they're put under that much stress. So yes, you may not be dealing with an issue now, but 10 to 20 years from now, as your blood pressure stays higher, your blood vessels weaken, and then it can cause serious issues like heart attacks or strokes. So you want to make sure you get in with your providers, get things checked out, and follow a healthy diet, exercise programs. And if you are put on prescriptions, take them every day just like you're supposed to.